This afternoon I'm here to talk to you about the role of nurses within the multidisciplinary GvHD care team. So what I want to really give you is an overview of the role of nurses in graft versus host disease care. And you can see from this slide that we, as nurses, we have many functions in the care of people who develop graft versus host disease after stem cell transplant. You know, we have opportunities to care for patients in relation to treatment administration, thinking about treatment-related side effects and unmet physical and psychosocial needs associated with the treatments. We also have roles in helping to support people who develop complications of treatment as well. As nurses, we pride ourselves in being superb communicators, and graft versus host disease care gives us an opportunity to be able to provide that clarity of communication to the patients, but also the multi-professional team. We have a function in monitoring and surveillance of patients for the signs and symptoms of graft versus host disease and the early detection of chronic GvHD. And also, we are always going to be documenting our findings, including assessment grading and presence or absence of graft versus host disease. And then, of course, nurses are practice educators. We're sharing education today in this room, but also in the clinical environment. We're teaching patients at the bedside in the clinics, supporting them and their caregivers and families, and also educating our peers in the clinical setting, not just educating nurses, but nurses also educating the rest of the wider professional team. We also play a role throughout the entire graft versus host disease journey or trajectory. So in the pre-transplant phase, we talk to patients about what they might expect from their transplant, including the side effects of allogeneic transplant, graft versus host disease. And educating our patients at that stage helps to prepare them for what may happen later in their post-transplant course. In the immediate post-transplant setting, we're there on the wards at the bedside, observing our patients, monitoring vital signs, reporting to the medical team any concerns that we might have. We might identify the development of acute graft versus host disease. It's really important to be able to recognise this promptly so that treatment can be initiated without delay, and we can evaluate how that treatment is going. We're also there in the chronic GvHD part of the journey, supporting patients with longer-term symptom assessment and management, making sure that we're vigilant around medication and medication adherence, but also thinking about further side effect monitoring. And then the long-term follow-up clinic, which is where I spend a lot of my time. We're thinking about the rehabilitation and longer-term support needs of patients. And all around that, trying to enable our patients to live a life for them that feels normal and fulfilled. So as nurses, we're doing lots of assessment, and we think about this as early symptom assessment, identifying those early, and then monitoring for symptoms during treatment, and being able to understand whether treatment is working, the extent to which that treatment might be effective, the side effects that it may be causing, or the challenges that patients may have in receiving that treatment. We're uniquely placed at the bedside to identify actually quite subtle changes in patients' conditions because we get to know our patients very well because of the amount of time that we spend with them. And patients, because of that relationship, patients often choose to disclose information to us that they may not feel comfortable to disclose to other members of the team for a whole variety of reasons that we don't really have time to discuss today. But these factors really can help to contribute to early identification of graft versus host disease, really enabling the support systems to kick into place for prompt intervention, and then the potential, of course, for optimizing the outcomes for patients. When we perform symptom assessment, we're using a whole range of validated tools. Of course, you know, the GvHD assessment tools like MAGIC, Modified Glucksberg, if you're still using it, NIH, but also thinking about enabling patients to report their symptoms using validated tools. And I'll talk a little bit about this later on. But it's really important to use these range of tools so we can support patients with aspects of the graft versus host disease experience that are important to them. We assess organ systems within those tools, and then we think about how we monitor treatment complications and symptoms actually during the treatment itself. I've talked a little bit about medication adherence, but also we need to be mindful of polypharmacy, which is something that can be an incredibly difficult issue for our patients to deal with. They're presented with, as you know, a whole bucket full of medications, and sometimes they may be incentivized to pick and choose which medications for them feel most manageable. And it's important that we're able to have an open dialogue with our patients about that, because if we don't know whether our patients are able to manage the treatment regime that is prescribed for them, then we don't know if that's being effective or not. And there's a lot we can do to support adherence in our patients. So these are the standardized assessment tools. I'm not going to go into a huge amount of detail, but these are incredibly easy to use in the clinical setting. Essentially, you're just gathering quite simple data from patients. You're plugging that data into a grading and staging tool to be able to come up with a grade and stage per organ at the end of it. It really is pretty straightforward, and I'm sure Hildegard will go into a little bit more detail about this. The MAGIC tool looks very much like the modified Glucksberg criteria, but here we have very usefully upper GI symptom reporting, which plays a huge role in being able to stage and grade accurately. Here we have the assessment tools for that can be used in chronic graft versus host disease. Most commonly is the NIH chronic graft versus host disease criteria, but here again you can see that there are clinician-assessed tools. Some of them help us to assess symptoms more so than others. Some of them help us to assess symptoms in particular organs. And on the right-hand side there, we see patient-reported tools. And the idea is that these tools are complementary and enable us to understand a much better and bigger picture about the graft versus host disease experience for patients. There are, of course, additional considerations during ECP therapy, and nurses really can play a very central role in this aspect, particularly with communication of patient responses to ECP within the multidisciplinary team and team meetings, utilising those assessments before, during and after therapy. And there's some essential monitoring, of course, that happens during the actual ECP treatment itself. And this is an incredible opportunity for nurses to build very solid relationships with patients who are experiencing ECP. And I think a lot of patients say that this is one of the most therapeutic relationships that they experience during the time that they're treated for chronic graft versus host disease. And you don't get this aspect of therapeutic relationship with other treatments. Vital signs. and tolerance, and of course side effects or complications. So I just see that my time is flashing as it's up. So the ECP sessions offer that opportunity for the emotional support and therapeutic relationship. And we have all of these other nursing considerations during ECP treatment days. One of the things that we need to do is make sure that patients are safe to receive the ECP treatment. So we need to make sure that the blood parameters are suitable and appropriate for there to be a treatment benefit. We talk often about access to ECP, and we need to be able to support patients to travel safely to those treatments, often using hospital transport or own transport systems, and also thinking about the way in which we bring that round to reassess during the follow-up stages of ECP. So nurses have a role in educating and supporting patients with chronic graft-versus-host disease. We work really at the intersection of clinical expertise. We work with patients as advocates, and we provide supportive care. We assess the knowledge and information needs of our patients, and we use lots of different techniques to do that, using materials, written, visual materials, but also strategies like teach back, where we get patients to talk back to us about what we've just told them. And it's important really that patients understand the implications of having graft-versus-host disease in addition to be able to provide appropriate support and care, but also for us to understand what having graft-versus-host disease means for our patients. I talked a little bit about this. And there are loads of resources for patients who are experiencing graft-versus-host disease, depending on the type of graft-versus-host disease that they have, and the stage at which that diagnosis of GvHD is happening. It's really important that we ensure that patients understand the significance and importance of being able to attend appointments and be able to receive treatments, but also that they're aware of clinical trials where they're appropriate. And we had a discussion in a session a couple of days ago about how we make access to clinical trials a little easier for patients. When we have patients who are educated and supported with their experience of graft-versus-host disease, then they feel more empowered in this process of shared decision-making. And this is not something that happens easily. It all evolves out of a relationship, this built on trust and rapport, respecting that our patients are autonomous. They have the right to make their own decisions, but it's important to utilise that opportunity to discuss treatment options and encourage the active participation of patients within that. Not just patients, of course, but also caregivers with our patients' experience. So when we educate patients and support patients when they're receiving ECP, it's important to explain the ECP process using a whole load of materials, describing the ECP process in simple steps. Of course, it's quite a different treatment from many of the treatments that our patients have been exposed to in other aspects of their care. So if we can make it feel more accessible and less daunting for patients, it feels a little bit easier to embark on that ECP journey. It's important to set expectations around the treatment. It's not a magic bullet. It's not going to work straight away. The effects will be seen over a number of weeks and months. And of course, important to answer any questions. We need to address concerns or misconceptions, but do that in a way that is encouraging and supportive. And then, of course, we know that any treatment for chronic graft-versus-host disease is likely to be a long-term commitment. ECP is not excluded from that. So we need to enable patients to think about receiving therapy in the long term, whilst also recovering from illness, and to be able to do that in a way to support patients to do more normal things and not just live a life that's focused on an illness and treatment for that illness. So we have a number of roles as nurses in facilitating an MDT approach to GvHD care. We're communicators. We help to facilitate interprofessional collaboration. We are true advocates of patients, their thoughts, their wishes, with knowledge about them built into treatment plans and care. We're key workers, so we're available to be contacted by pretty much everybody involved in the care of our patients, and including patients and caregivers. And we have a commitment to knowledge sharing. So we promote a team-based culture in supporting other healthcare professionals to provide education and training. So just to wrap up, and I'm sorry I have run over time, how do we support nurses to deliver optimal graft versus host disease and ECP care? Well, with enhanced HCP training, sessions like this, but also a whole host of resources that are available out there, optimizing MDT collaboration, streamlining pathways and workflows for ECP to make it feel much more accessible for patients and to make it feel more accessible for clinicians to refer patients for ECP, enhancing the education and support that we provide for patients and their caregivers, making sure that we utilize our documentation as often communication tools for other health professionals, promoting research and evidence-based practice, and improved access to advanced technology. So the questions that's come through is about challenges that we face in practice in ensuring effective communication between patients and the wider healthcare team. And I think, as a nurse, well, I perform this function as a key worker. So, I have patients, people that are under my care, and my responsibility is to them and to ensure that I'm in a position to be able to advocate on their behalf when they're not present for conversations that might be happening about them. And so that's a very important element, really, is to be able to develop structures within practice that support that effective communication. I think also it's really important, we can't advocate for our patients unless we really understand what their needs are. And to be able to assess those and understand those in a way that's free from our own preconceptions or biases. So I think those are really important. I think that, examples of communication is making sure that we make accurate notes when we have correspondences or interactions with our patients that other members of the healthcare professional team can read and access, but also making sure that we're present during difficult conversations that often happen with patients. So not only are we there to hear those, we can also help and support our patients to articulate what it is that they really want to say in those moments, and also be there to truly be able to support them afterwards.